Welcome to This Explainer. So you're standing at the 2026 crossroads of healthcare, right? You're ready to weigh a massive high-stakes decision: medical school or pharmacy school. This isn't just about picking a job. This is a monumental choice that's going to shape your entire adult lifestyle, your financial future, and honestly, your everyday reality.
Because look, both of these paths lead to highly respected six-figure careers. Absolutely. But the toll it takes to actually travel them and the daily grind on the other side, they're vastly different. So if you're sitting there asking yourself, which one should I go for, pharmacy school or medical school 2026, you are definitely not alone. It really begs the question, which white coat truly fits you? Well, we're going to use the latest data to find out.
Okay, let's map out our agenda real quick. We'll be covering 1, surviving the admissions gauntlet, 2, the financial reality check, 3, residency and career trajectories, 4, workplace realities and burnout, and finally, which path is yours?
All right, Section 1, Surviving the Admissions Gauntlet. Let's see how this all builds, starting with the very first hurdle literally every pre-health student faces: actually getting the acceptance letter.
Notice the stark contrast in these gatekeeping models. It's wild. Medicine remains this highly selective filter, basically acting as a massive funnel that turns away more than half of its applicants, with a 42.8% acceptance rate. On the flip side, pharmacy has shifted to a much more accessible, high-acceptance model, letting in almost 87% of applicants. To put that medical bottleneck into perspective, just think about this staggering number: 54,699. For the 2025 entering class, almost 55,000 applicants competed for just over 23,000 spots across the country. That is a massive pool of highly qualified people, meaning you're competing against the absolute best of the best just for the privilege of taking on a crushing workload. Meanwhile, pharmacy programs, they're seeing a modest 6% uptick in interest, but they retain incredibly welcoming admission metrics. They're actually phasing out their standardized test, the PCAT, and the average enrolled student has a cumulative GPA of 3.41. So the barrier to entry here is substantially lower. And hey, that's great news if you're looking for a more predictable, straightforward path into a professional healthcare doctorate. Moving on to Section 2, the financial reality check. Let's talk money. Because while the yearly tuition between these two professional schools is actually extremely similar, the debt-to-income realities, they couldn't be further apart.
This brings us to a really crucial financial reality you need to prep for. Check out the debt-to-income, or DTI ratio. For a pharmacy graduate sitting at a 1.24 DTI, your average debt of $171,000 physically outpaces your median first-year salary by 24%. It's a really heavy burden to carry right out of the gate. But then look at the medical grad. Sure, their debt is pushing $250,000, but it's easily eclipsed by a massive average income of $386,000. That gives them a much more manageable 0.64 DTI. So yes, the doctor owes more, but they make so much more that paying it off is mathematically way less stressful. Section 3, Residency and Career Trajectories. Now, understanding your overall debt is honestly only half the battle. We also have to look at when you actually start making that big salary. This earning timeline perfectly illustrates the massive delay in position gratification. You both spend 4 years in professional school, right? But then in year 5, while a medical resident is grinding it out for maybe $30,000 to $40,000 a year working absolutely brutal shifts, their pharmacist peers already pulling in a full 6-figure salary right out of the school gates. The physician isn't going to see their full earning potential until year 9, or even later. And the reason for that delay? Medical residency is an absolute mandatory bottleneck. You literally cannot practice independently without completing a 3 to 9 year residency, period. Pharmacy residency, however, is completely optional. That allows pharmacists a direct, immediate route to practice in a retail or community setting the second they pass their boards.
But let's say you do want to specialize in pharmacy. Maybe you want to get off the retail floor and work in a hospital setting or oncology. You can absolutely opt for a residency. And the odds are very much in your favor. In 2026, 84.4% of applicants successfully matched into a PGY1 pharmacy program.
Okay, Section 4, Workplace Realities and Burnout. Let's look at how all of this builds into your actual day-to-day life. Because, spoiler alert, both of these professions face incredibly high burnout, but for vastly different systemic reasons.
When it comes to the clock, physicians are working significantly longer schedules. They average nearly 58 hours a week compared to a pharmacist's standard 40. Now, if a predictable 9-to-5 schedule where you can actually go home, see your family, and have a life is a top priority for you, pharmacy offers a much more standardized work week. But, as we're about to see, fewer hours doesn't always mean less stress. Look at exactly where those 58 physician hours go. Out of that massive work week, doctors spend barely half of their time, just 27.2 hours actually treating patients. The rest of their time is just swallowed by screens. 13 hours of grueling electronic health record documentation, and over 7 hours literally fighting with insurance companies over prior authorizations. The administrative burden is just massive.
But wait, pharmacy has its own systemic crisis going on. A shocking 71 to 91% of retail chain pharmacists report experiencing severe workload burnout behind the counter. So they might be working 40 hours, but those 40 hours are described as a high-pressure, metric-driven gauntlet. The supply of graduates has basically given corporate chains the leverage to push pharmacists right to their breaking point.
To escape this retail burnout, the entire field of pharmacy is rapidly shifting. We're seeing a huge push towards specialized clinical roles in hospitals and institutional settings. Through things called collaborative practice agreements, or CPAs, pharmacists are actually expanding their patient care autonomy. They're gaining delegated diagnostic and prescribing rights while working closely under physicians. Basically, pharmacy is moving out from behind the cash register and directly into the clinic.
Which brings us to our final section. Which path is yours? Because after looking at all this data, the choice between these two paths doesn't come down to which is universally better. It really comes down to a deeply personal reflection on what you value most for your future.
Ultimately, you are weighing two very clear trade-offs here. On one side, you have to balance the ultimate clinical authority and the incredibly high financial ceiling of a doctor against the grueling 58-hour weeks and a decade-long training delay. On the other side, contrast that with the pharmacist's faster, more predictable 40-hour schedule, balanced against a much tougher debt-to-income ratio and the looming risk of severe retail burnout.
I'm going to leave you with this final, provocative thought for our explainer today. Look beyond the prestige of the title. Look beyond the Instagram-filtered versions of these jobs and ask yourself, which daily reality do you actually want to wake up to? Do you want to be the ultimate diagnostic authority, or do you want the predictability of a faster path to practice? The data is right in front of you. Now the choice is yours.